Just Connect TV, streaming live. Just Connect TV is your entertainment and educational channel. We broadcast authentic content that will inspire, empower, and stir up the potential and positive energy in you. Just Connect TV, streaming live. Ever felt the need to learn how to play a musical instrument or improve your music skill and never knew where to go? Just Connect School of Music is the place to be. We offer professional training in music sight reading, piano, drums, guitar, saxophone, bass guitar, and vocal training. We are located at Eprin Square, 3rd floor, room 26, opposite Buruburu Police Station. Just Connect, building worship. Get yourself a high-quality branded hoodie, t-shirt, caps, umbrellas, you name it, we got it. You order, we deliver. Just Connect.
Hello viewers, this is Just Connect Online TV, your show, Me and My Health, and today we will be addressing diabetes, and I'm joined with Dr. Waithaka. Karibu sana.
Asante sana.
You can say hi to the viewers as we go ahead.
Yes, hi to the viewers.
Karibu sana. So today we'll be addressing the issue of diabetes, which has been a big challenge in the society. Probably you can tell us what is diabetes and what are the factors that predispose one to diabetes.
Okay. Now, diabetes, which is commonly known as diabetes mellitus, is one of the four most serious non-communicable diseases. The others being cancer, chronic respiratory disorders, and cardiovascular disorders. And diabetes can basically, in a very simple way, be defined as a long-lasting disorder that is characterized by elevated, very high blood glucose or blood sugars. And this is a result of the body being unable to break down and build up the food that we eat into energy.
Okay.
And as a result of that prolonged period of time with very high blood sugars, diabetes has very serious health issues to do with the heart, the kidneys, the eyes, and the lower extremities, just to mention a few of the body parts that it affects. There are many bodies that have tried to classify and make a diagnosis for diabetes. And I think one of the most popular is the American Diabetic Association. And in a very simple way, when you have your blood sugar taken, there will be a couple of lineages that can either define normal blood sugar, pre-diabetes, which is a very important condition as we will see as we go along, and then diabetes itself. Usually people are asked to fast for a period of 8 to 12 hours before you do what is called a fasting blood sugar.
Okay.
And then again, there is another parameter that is also done when you have fasted for the same period of time, which is called hemoglobin A1C.
Okay.
And then the third category that can help to make a diagnosis of diabetes are the classical symptoms of diabetes, together with a random blood sugar, which is taken without any requirement for fasting. So for the fasting blood sugar, the normal should be less than 100 milligrams per deciliter. And a diagnosis of diabetes will be made if you have two measurements that are in excess of 126 milligram per deciliter. In between 100 and 126 is called pre-diabetes. And this is, as I said, a very important diagnosis to make, because within a period of 10 years, if it is not treated, it will turn out to overt diabetes.
Okay.
Maybe for the sake of simplicity, then we can go to the classical symptoms of diabetes.
And before we go to that, you've mentioned the parameters of the ranges of blood sugar.
Yes.
But there are people who measure it and they are given in other how do I put
units.
this? Units, yes.
Yes, that is an important issue because the laboratories will do it differently.
Exactly.
The 126 that I gave is equivalent to 7 millimoles per liter. And that is why it is important to know exactly the units that define the ranges that I mentioned.
Yeah.
Now, proceeding on to the symptoms, I'm still trying to classify and make a diagnosis of diabetes. The classical symptoms of diabetes are excessive urination that will require you to wake up at night multiple times, even without having consumed a lot of water. The second one is excessive thirst and hunger. And then the other one is, of course, with excessive thirst, you end up consuming a lot of water.
Exactly.
When you have those symptoms and others that would include tingling sensations on the extremities, blurring of vision, headaches, and then we do a random blood sugar that will not require you to have fasted for what I said, 8 to 12 hours. Then if we find that your random blood sugar is above 200 and above in terms of milligrams per deciliter, or 11.1 millimoles per liter on 2 occasions, then again, diagnosis of diabetes is made. So after you have, for random blood sugar, the normal should be less than 140 milligrams per deciliter, equivalent to 7.0 millimoles per liter.
Okay.
So in that range between 140 to 199, again, that is pre-diabetes.
Okay.
Now, there is a measurement, is usually a bit expensive, and patients are required to do it at times, and I have found them the question why. But one of the most important parameters in terms of classifying and making a diagnosis for diabetes is a HbA1c, because it will give you an average of how your blood sugars have been for the past 2 to 3 months.
Okay.
So usually a HbA1c greater than 6.5 on more than, again, 2 times, you make a diagnosis of diabetes. If it is between 5.7 to 6.4, that again is pre-diabetes.
Okay. Okay.
And then less than 5.7 is normal. So basically, in very simple terms, that is what I would say is required to make a diagnosis.
Okay.
In terms of classification, diabetes can be divided into 4, and I'll go through them very briefly.
Okay.
You have what is called type 1 diabetes, where insulin is required in order for you to be able to maintain normal blood sugars, and is usually found among those that are less than 30 years.
Okay.
And then there is the type 2 diabetes, which is actually where a majority of the patients will be found. In fact, greater than 95% will have diabetes type 2. Where usually the diagnosis is made when somebody is way advanced in years, normally at around 50 years of age. The patient is usually obese, and they can do oral drugs to control diabetes.
Okay.
Usually the cause of type 2 diabetes is insulin resistance. The body is unable to use insulin the way it should use insulin. Then there is gestational diabetes. That is when a mother or mother-to-be, an expectant woman, is found to have diabetes for the first time in the second and the third trimester. And then there are secondary diabetes that can be attributed to a particular cause.
Okay.
Probably somebody who has been on treatment for HIV, for cancer. Those drugs, certain drugs are known to cause diabetes.
Okay.
Yes.
And this is the reason why the people who are undergoing, who have, say, HIV and cancer, have to undergo tests every few months, and they are like on a schedule of testing.
Yes.
Okay.
In order to be able to monitor the adverse effects of the drugs that they are receiving, and to make sure that we don't miss a diagnosis either of pre-diabetes or diabetes, because it will have very significant impact on the outcome of such patients.
Exactly.
Yes.
If we were to go deeper into understanding what happens in a diabetic case, because people have a lot of myths about diabetes. What are some of these common myths that people have that make them not to take diabetes seriously?
You see, one of the most important things about diabetes, just like hypertension that we had discussed some times back, is that the symptoms are subtle. So you will not be able to know by virtue of the symptoms unless the disease is very advanced. And I can probably mention and say that one of the myths is that you go and probably by accident or by just sheer a chance, a random blood sugar is taken and is found to be elevated, and you ask to go for a fasting blood sugar. So you refuse, when you are given the figures, you refuse to accept that you have diabetes. So that's one of the myths, people living in denial. The second one is that diabetes can be cured. So either people can decide to go for traditional, herbal medicines.
Yeah.
And they are told that diabetes has been cured after a while. Diabetes is a long-lasting illness that at the moment has no cure. And I think it is important for our viewers to understand that. The other thing is that, the other myth is that as long as I'm feeling okay, I'm better, and I can continue with life. But the problem is that as you ignore the facts, the scientific facts, the disease is ravaging your body.
Exactly.
And by the time you go to seek help, it's already too late. And probably very few things can be done to improve the quality of life. Yes.
There is I don't know whether this is a myth where somebody, because it is associated with sugars, the consumption of sugar within the body. What is the relationship? Since you mentioned about insulin being the chemical,
the hormone
that controls the blood sugar.
Yes.
What is the relationship of sugar intake and insulin?
Now, usually for a normal human being, when you take a meal, the food that we take is broken down into the basic elements that can be absorbed by the body. For the carbohydrates, whether we took them either refined or they were the ones that are not refined, they will be broken down by the enzymes and hormones that are found within the gastrointestinal system into glucose, or rather sugar. There are other sugars other than glucose.
Yeah.
And this glucose is the one that is absorbed into the bloodstream. So you can imagine when you've taken a good meal of ugali, 20 minutes afterwards, you have the highest amount of glucose landing in your blood.
Okay.
So what that glucose does, it sensitizes the pancreas to secrete the hormone insulin. Now, what insulin will do, it will be the key that you tell the cells of the body that are found either in the muscles or in the adipose tissues, or even in the, and actually much more importantly, in the liver, to remove the insulin from the blood and put it into use, either to burn it into energy or to store it as glycogen, so that we have an almost uniform quantity of glucose in blood.
Exactly.
So now, in the event that you have no insulin, see, what will happen is that the glucose will keep on increasing and increasing.
Oh, yeah.
Because it cannot be taken by the cells that I have mentioned. And it cannot be properly used as energy.
Exactly.
And at the end of the day, you are either having a problem with the quantity of insulin that you are producing, or the body, for one reason or another, is unable to utilize that insulin. It's not sensitive to the insulin. It starts resisting the effects of insulin.
Okay.
Yes. And
there is that possibility that there can be insulin, but the body refuses.
The body refuses. The cells refuse to take. They refuse to take the signal that you allow them to absorb insulin from the blood, and therefore there will be insulin. Yes, but basically the blood sugars are still elevated.
Okay.
Yes.
And the amount of activity, say through exercise or working, help the body to absorb this glucose so that it's cleared in the body?
Yes. In fact, as we will see in a short while, when we deal with how we can manage diabetes, the level of a human being activity is very important in terms of making the muscles sensitive to the effects of insulin.
Okay.
And also, much more importantly, reducing the amount of adipose tissue that a person has.
Okay.
Because obesity is a major risk factor for diabetes. And one of the proven ways of maintaining an ideal body mass index is through physical activity.
Okay.
And as we deal with the physical activity, I think it is important that I mention, because we might forget. It doesn't matter that you are engaged in a regular exercise regimen. One of the most important things also to understand is that a sedentary lifestyle is not just about the lack of exercise. It's just about sitting down.
Okay.
So it's usually recommended that even if your engagements on a daily basis, the nature of the work that you do is for you to sit down within a period of 30 to 1 hour. Get some time, stretch, walk a bit, and then return to your usual seat where you work. Because that is now, it will go a long way in helping your body.
Exactly.
Yes.
There's something you mentioned about type 1 diabetes.
Yes.
That it affects people below 40 years.
Below 30.
Below 30. So what are the factors that cause this to happen?
Now, one of when you consider type 1 diabetes, our viewers may recall that I said you will require insulin. The injectable insulin to be able to control the blood sugars. It's not as clearly well defined, the risk factors for type 1 as it is for type 2. But the underlying problem that causes type 2 is actually seen to be an autoimmune problem. Your body fights against its own tissues in the pancreas. The cells that secrete insulin are called the islet cells. So the body, for one reason or another, identify them as enemies and starts a process to destroy them.
Okay.
And they are completely destroyed to the extent that there is no insulin that can be produced.
That is now for type 1.
That is for type 1. And it doesn't have a very clear genetic link like for type 2 diabetes.
Okay.
Yes.
So it has nothing to do with genetics to the greater extent?
It may have to do with genetics, but it's not as clearly explained through research as type 2 diabetes.
Okay.
Yes.
If we come to type 2 diabetes, because you said that 95% of almost everyone with diabetes is on this,
Yes,
in
that
this
category, type 2,
classification.
yes.
What are these predisposing factors?
Now, for type 2 diabetes, I said that the diagnosis will be made later on in life as somebody advances in the years, starting from the ages of 45 and going onwards. One of the major risk factors for type 2 diabetes is a family history of diabetes. So if you've had a first-degree relative, either a parent or even a sibling, who has had diabetes type 2, you have a 2 to 3-fold chance that you develop type 2 diabetes. And that is why it is important for our viewers to be educated, so that should they have this kind of a risk, they can start probably a little earlier, become proactive instead of being reactive in terms of managing their own health. So that is one of the major risks for type 2 diabetes. The other risk is obesity.
Okay.
Yes, and that is why we keep on telling people, do your body mass index, ensure that it is within the ideal age, and then keep on, maintaining that particular body mass index, because there is a greater risk when you are obese that you will develop diabetes. Okay. The other risk factor have to do with race. Africans and Asians are much more likely to develop diabetes than the whites, so to say.
Okay. We'll take a short break. This is Just Connect Online TV, your show, Me and My Health. We'll get back.
Just Connect TV, streaming live. Just Connect TV is your entertainment and educational channel. We broadcast authentic content that will inspire, empower, and stir up the potential and positive energy in you. Just Connect TV, streaming live. Ever felt the need to learn how to play a musical instrument or improve your music skill and never knew where to go? Just Connect School of Music is the place to be. We offer professional training in music sight reading, piano, drums, guitar, saxophone, bass guitar, and vocal training. We are located at Eprin Square, 3rd floor, room 26, opposite Buruburu Police Station. Just Connect, building worship. Get yourself a high-quality branded hoodie, t-shirt, caps, umbrellas, you name it, we got it. You order, we deliver. Just Connect.
Welcome back. This is Me and My Health show at Just Connect Online TV. I'm joined with Dr. Waithaka, and we were addressing ourselves on the Africans and the people from the Asian community being more predisposed to type 2 diabetes. What is the relationship?
Now, I think the relationship has to do with the genetic makeup. The races can be traced to, as we go ancestry, as we go the generations that have gone by. Okay. And this is still a matter that is still subject to research, but it has been clearly demonstrated by research that the tendency to develop diabetes is much higher for those two races than it is for the whites, as I said.
And before you go on, to what extent should I be bothered about my generations? So as I'm following up the genetic issue of any particular disease, should I to what extent should I be concerned about this? I
think it is important to get out of the fear that if you dig deep into what happened to the people that have given birth to you and to them, you might get certain bones or skeletons.
Exactly.
So to say.
Yeah.
It is important because the benefits accruing from acquiring that knowledge have been proven. They are phenomenal. Because should you know that your grandfather, for instance, or your grandmother had diabetes, then you know that the chances that you may develop diabetes are much higher than somebody in whose lineage there has never been a case of diabetes. And you see, in medicine, we usually say that prevention is better than cure. So it is better to prevent than to wait until the disease sets in and then you start treating the same.
Exactly.
And I think it is another example that should you wait longer than is necessary, you might not be able to utilize
exactly
the lifestyle changes and the behavioral changes that are found to be beneficial with preventing or slowing down the onset of diabetes. Because if you're starting to do physical exercise when you are 60 years with, diabetes that has affected your heart, you see, you will not be able to maintain that kind of rigorous schedule. So it is important for us to look at those things and also to prepare us to forewarn our children. These are some of the information that we can pass to our kids early enough, because if you know you have diabetes, it doesn't harm to tell your kids that there is a higher likelihood of them having diabetes, so that you can start to instill the culture of prevention and health promotion.
So it doesn't have to always be, because most of the times people look at it from a negative perspective, and the way you brought it is a very positive outlook of how you can benefit by that knowledge.
Exactly.
Now, going forward to the other factors that predispose people to the type 2, which ones are they?
The other factors are, and I think it is important for our viewers that are women to know, is that if you are found to have gestational diabetes, that I say is usually diagnosed in the second and the third trimester, you need to go for a further checkup about a month or 2 months after you have delivered. Because the chances that you will develop diabetes mellitus now, after you have had a prior diagnosis of gestational diabetes, is also much higher than for those that have not had gestational diabetes. And of course, with advancing the advancements that have been made in medicine, people are living longer. And diabetes is also found to be much more common as you advance in ages. Actually, majority of the type 2 diabetes will be diagnosed in the ages of 60 and above. Yes.
For a mother who has gestational diabetes, does it necessarily mean that the child they are carrying will have diabetes?
No, it doesn't necessarily mean that the child will have diabetes. But of course, as we said earlier, if you have had a first degree relative with diabetes, your chances of having type 2 diabetes are elevated. So that child may be born normal, but later on in life, their chances of developing diabetes will be much higher than a child whose mother did not have a gestational diabetes. But the reason why it is important for mothers to confirm their diabetic status, especially when they are expectant, is because it has a lot of impact in terms of the methods of delivery and the dangers that can arise both to the mother and also to the newborn. You remember one of the things that will happen with, because there is derangement in terms of sugar, usually the infants or the infants tend to be very big at the point of birth, which can have a very big impact in terms of the mode that may be chosen to deliver that child. Yes.
And as we stay on the children, is it possible to have a child developing diabetes, and how would you diagnose this? And maybe the parents who are not predisposed to the diabetes, there was no gestational diabetes, there is no history of diabetes that is known or reported, and what are the possibilities of a child developing diabetes?
As we said earlier, children will most likely develop diabetes type 1. Mm-hmm. And it is a smaller percentage compared to type 2, mm-hmm. probably less than 5%. Mm-hmm. Now, making a diagnosis in a child is very difficult, because a child will not report the symptoms. Mm-hmm. So it requires a very high degree of suspicion in terms of the healthcare worker. Mm-hmm. Mm-hmm. That is why we recommend to our mothers, when you've delivered that child, make sure you follow up in terms of the recommendations by the government. One of the best opportunities is when you are doing the vaccination, mm-hmm. before the first 1 year, mm-hmm. of life of this child. Mm-hmm. And thereafter, you need to proceed until 5 years. Mm-hmm. Mm-hmm. Because usually, if there is a very keen healthcare provider, they will be able to pick a child that has a likely possibility of having diabetes. Mm-hmm. Mm-hmm. Diabetes type 1 has nothing to do with obesity. Okay. In fact, what it has everything to do with catabolism. Mm-hmm. And in catabolism, I mean the person burns both fats and the carbohydrates, mm-hmm. to a very large extent that they tend to lose weight. So if you have a child that is losing weight and they are eating well, then there is good reason for you to suspect that something could be wrong. Okay. And this child can be taken for testing, and probably a diagnosis of diabetes can be made early enough. Mm-hmm. Because type 1 diabetes patients can present acutely within a very short time, okay. a period of a week or 2 weeks, with very serious symptoms. Mm-hmm. Mm-hmm. A disease that is called diabetes ketoacidosis, where okay. the child is taken in a coma, mm-hmm. and the outcomes usually are bad. Okay. And you see it will happen to a child who has not been known to have diabetes. Mm-hmm. So for children, I think it is a high degree of suspicion on the part of both the parents, mm-hmm. and the healthcare provider. So
it is required that the parent has to be keen. Mm-hmm. And I'm also thinking that there is this issue that has developed within the community of self-diagnosis, self-treatment, mm-hmm. and also opting, unasema, I haven't visited so and so, that is why this child looks like this, mm-hmm. and then you may miss out on an opportunity that would have saved the life of this child. Yeah,
I think, as we said there before, the health-seeking behavior of our population, mm-hmm. is at times very weird, and I need to probably let my fellow healthcare providers understand that diabetes is not a disease that you can treat in isolation as an individual. Mm-hmm. Actually, the best outcomes in diabetes treatment, mm-hmm. are done by a team. Okay. So you need to have a well-coordinated team that will include the physician, the nurses, the nutritionist, the people who deal with foot diseases, mm-hmm. Mm-hmm. and others like the ophthalmologist for the eye. So you need to assemble a team. Mm-hmm. Mm-hmm. And one of the things that has been found to help in terms of patient compliance, and also having good outcomes in terms of treatment and the quality of life of patients with diabetes, mm-hmm. is the language that you use. It is important for the healthcare provider to ensure that they do not use language that will advance discrimination against people with diabetes. Mm-hmm. Mm-hmm. And a very common term that you hear a lot of people use is that diabetic, which is a very bad, so to say, because the language must be patient-centered. Exactly. It's better to say a patient with diabetes, yeah. than to use a language that will advance stigma against diabetes. Mm-hmm. Mm-hmm. And while I'm still at this, mm-hmm. I think it is important for me to also mention and tell our people that it is important for them to trust the scientific ways of doing things. True. Because you find that people have a lot of beliefs, though they are important and we need to understand them in order for us to be able to help them.
Yeah.
But I think it is also important to tell them that the health care facilities and the delivery systems that have been put in place by the government are for their benefit. And before they go to those other folk, treatments, I think it is important for them to take care of their children in a good way. And while at this, I think faith in God cannot be an excuse as to why you should not seek treatment. And I think I need to commend the government because it has been very forceful that should you be found to have refused to take your child or a dependent to hospital on account of faith, you will be arrested, just like it will happen if you refuse to take your kids to hospital. Yes. Yes.
Very important. And I believe our viewers are taking keen interest on that. You mentioned about also the secondary factors that secondary diabetes, causes of diabetes.
Yes.
What are some of these causes?
Some of those causes will involve drugs. People that are under, constant, regular and prolonged use of certain drugs, including steroids. They have been known to be more likely to develop diabetes type 2. And also others like alcohol. Even the liver itself plays a big role in terms of energy metabolism. And also when you are taken to consuming a lot of alcohol, and especially the ones that have very high alcohol content, patients develop acute pancreatitis.
Okay.
And if it develops into chronic pancreatitis, then the pancreas will not be able to secrete insulin, and you end up having secondary diabetes. The other diseases that are known to cause harm to the cells that produce insulin. So we are saying in terms of secondary diabetes, a very small subset, probably less than 2%.
Okay.
But it is still important.
Yeah.
And while still at this, I think it is important for me to mention to our viewers that generally it is recommended that should you have a diagnosis of diabetes, or you find that you have a higher risk of developing diabetes, you stop alcohol consumption and you also stop smoking. They have been found to have a very big bearing in terms of the ability to control and to delay the onset of diabetes. Yes. Yes.
Going further, we look at the diagnosis. How is the diagnosis? You had mentioned about it. You had talked about the HbA1c.
Yes.
Then you had talked about the random blood sugar and the fasting blood sugar. There are those opportunities that are availed in the community on screening.
Yes.
As you bring all this together, how do you diagnose diabetes and where do we go from there? Once somebody knows they either have whichever level or degree it has gone, how do we go from there?
I think one of the most important preventive measures in terms of health promotion and disease prevention is screening. In the Western world, it's recommended that any person, whether they feel they are healthy or not, when you hit the age of 45 years, you have to go for screening for diabetes. An actual test will be done, either the fasting blood glucose, the HbA1c, or the random blood sugar, together with the symptoms that we had listed there before. And then if you are found to be normal, you are educated in terms of how you can maintain your health status. And if you are found to be pre-diabetic, then what will happen is that you will be taken through health education in terms of what you can do, the dietary changes that you need to put in place, the lifestyle changes that you need to put in place, and generally what you need to do or you can do as a person to help yourself get out of the risks of developing overt diabetes. If you are found to have diabetes, then the lifestyle changes that we have mentioned throughout this program will be instituted.
Okay.
And alongside with the lifestyle changes, you may be able to get a drug prescribed. And usually the commonest drug is called metformin. And that is taken especially by the patients that are obese because it helps to reduce weight.
Okay.
Alongside now with the lifestyle changes that we mentioned. Now, for the patients, because I have had patients that have been very resistant to using the injectable insulin, especially when they know they have type 2 diabetes, they want to argue that insulin is only for the ones that have type 1 diabetes. There are about 3 criteria that a healthcare provider will use to recommend that you, alongside with the other things that you need to do to control your blood sugars, that you have injectable insulin. One of them is for patients that have lost a lot of weight because it is evidence of ongoing breakdown of body muscles. And it's called catabolism. If it is still going on and you're on drugs and you're on an ideal dietary regimen and exercise regimen, then there is reason for the healthcare provider to add insulin. And that tells you that your level of production of insulin is going down. As much as there is resistance to the insulin which is there in the body, the level of production is also going down.
Okay.
The other thing is that if you presented with a blood sugar that is greater than 16.7 at any one time, or you presented with a serious complication of diabetes and the sugars have refused to come down, then again insulin can be prescribed. It can be monitored over time, and if it is established that your sugars normalize, then it can be reduced and it can be weaned off.
Okay.
So basically those are the things that might prompt a healthcare provider to give you injectable insulin as a basis of treatment. But usually, if you are on this drug called metformin, it will still be continued, and you continue with your regular exercise and the dietary changes that you instituted before. But most important in terms of improving the outcomes of the treatment is to involve the patient. A patient who is empowered to manage their own condition and motivated to continue to do so is a better patient than you just giving instructions which might not even be followed at home.
Exactly.
Yes.
Yeah. I'm looking at as you're on that the issue of follow-up of the patient with the clinics. Does that help in the management of the disease? Because not the condition, sorry. Because you find that somebody is scheduled for clinics, but they don't see them. But as long as they feel they are okay, they will wait until they have all the symptoms.
That is for the diseases that are not dramatic in terms of symptom presentation. That usually is what happens. Because patients will self-medicate. Patients will even refuse to take the drugs. And they even claim to one or the other have been healed. Only for them to turn up in hospital later on with serious complications. So I think it is important for our patients to understand the need for getting involved in this disease management. It is a partnership. It cannot be left to the healthcare provider alone. It's a partnership between the healthcare providers as a team and also the patient.
Exactly.
And many patients have agreed to buy glucometers to keep on monitoring on a regular basis their blood sugars, especially when they have been educated and they can identify with the process of improving their own health.
Exactly.
And others have been given regular follow-ups. Usually the follow-ups are kept to a bare minimum. It's not that the healthcare worker wants the patient to leave their activities for no reason.
True.
They have been tailored. The visits have been tailored to help the patient to continue with their lives normally, but also to make sure that they slow down the complications of diabetes. Usually it is recommended once a diagnosis has been made, the follow-up can be fortnightly. And then as the sugars get controlled, then it is taken to quarterly. That is for every 4 months. And there are a couple of things that have to be done by the healthcare provider. And probably just in case, because in the rural areas you find that it is a nurse who is doing the same. Probably she may get an opportunity to listen. It is important for them to do the following things when the patient presents for a follow-up. They need to understand the drugs that the patient was put on. And they need to look at the amount of drug that the patient is taking, so that they can be able to tailor that with the results that they'll get when they do the random or the fasting blood sugars, just to see whether the target that they set together with the patient are getting achieved or not. They need to inspect the patient's feet. Very important, because one of the long-term complications of diabetes is loss of sensations in the distal parts of the body. That has to do with the feet and the legs. And when they lose sensation, if inspection is not done early enough, you might find a patient presenting with a diabetic foot that might eventually lead to the patient losing their foot, when it could have been detected much earlier. And they need also to educate the patient on self-inspection of the feet. One, the feet need to be washed on a daily basis, because they need to be dried, because diabetes predisposes them to fungal infection. And it can be the needles that the bacteria will use to start the process of developing foot infection. Then again, the kind of shoe that they need to wear, they need to be advised on the shoe, both the size and the comfort therein. And the fact that they need to inspect the shoe before they put their foot in. Because if there was a stone, they will not be able to feel the stone. And so as they continue learning and doing their daily work, that stone is injuring the feet. And eventually that is where the infection will come in. And because of the diabetes, usually treatment for those foot disorders is, especially when they get infected, is very difficult. Then the other thing that needs to be done, and I think the recommendation is yearly, they need to get a dilated examination of their retina, because the retina has very many small vessels.
Now this is the eye.
The eye. Yes, because, and I think it is important to let our viewers know, diabetes causes about, at the moment, there are about 1 million blind adults whose cause actually is diabetes. So you need to keep on getting your eyes, your retina examined, just to make sure that you are not missing something.
Exactly.
Then the kidney functions, because the diabetes affects the kidneys, should be done at least every 3 or 4 times in a year. And then, of course, the heart need also to be examined, because it has also, it usually takes a very big beating from diabetes. And then the patient, you need to also assess the level of knowledge of the patient. Yes. And I think, Maina, one of the most important things for the patients that may be listening, that are suffering from diabetes, it is important for your healthcare provider to assess whether you have had an incident of hypoglycemia, that is decreased blood glucose, because it's very dangerous, especially for the ones that are aging. So those are the things that should be assessed on a regular basis. And it is very bad for a patient to be rushed to follow-up, because the people that the government pays are there to take care of their health. So it is important for them, again, as I said earlier, to become proactive, to make sure that they are the ones that are advancing their own agenda by being available when they are called to present themselves.
Exactly.
And making sure that they have controlled their sugar. Yes.
What is a place of positive mindset in managing the blood, the diabetes condition? Because with all this responsibility that the patient has, then they have to have a positive mental perspective. Otherwise, they will not follow up on this.
Yes.
So what is a place of having a positive mind, that this is not a license to, expire?
Yes. Now, you have actually mentioned one very important thing that probably we may have forgotten. for every patient that has a chronic illnesses that span decades, and which will not be treated, right? Which will not be cured in the course of their lifetime. Mental issues are serious comorbidities, and they go hard on hard with the treatment for the actual disease, organic disease that the patient has. You see, somebody getting type 2 diabetes gets the disease at the peak of their lives, when they are depended upon by their kids to a very large extent, when they are just about to retire from employment. And the limitations that are associated with the disease for those that are in self-employment are phenomenal. If you get a diabetic foot, you are consigned to a bed greater part of your day. You can't be able to resourcefully engage yourself. And also, diabetes treatment is expensive. It is expensive because though the government has really tried, but it's not like HIV/AIDS where patients receive drugs almost free of charge. In diabetes, you have to get yourself to buy the drugs and to keep taking them on a daily basis. And then again, you see there are no drugs that you take for a long time that have no adverse side effects. And then again, also the thought that you may be developing serious complications that eventually might lead to death. Those are things that go through the mind of a patient who has had a diagnosis of diabetes. And it is very important for the healthcare provider to be able to identify serious risks to do with anxiety, to do with depression, because they tend to arise. And even eating disorders. You can imagine somebody has an eating disorder and they have diabetes. I don't know whether you have realized that even for us, when you get stressed up, you tend to eat a lot and the sweet things in life. I think it's just part of
healing.
It's part of
Kupatia mwili pole.
Yes, kupatia mwili pole. I mean, it started right when somebody was a toddler. Every time you kind of disturb a toddler, the first thing they want to do is to suckle. So that goes on in life, and you might find that it's a very big problem because somebody with an eating disorder and has diabetes, I mean, you can never control those sugars. And you see, the patient will not know initially that they have an eating disorder until it is explained to them. And then again, there are those that go into cognitive impairment that is associated either with dementia or other age-related issues to do with the mind. And you can imagine somebody who is impaired in terms of how they perceive things. And they have drugs that they are taking. They even take an overdose of the drug. So there are a wide range of mental issues that diabetes has to do with that need to be seriously addressed. And these are the things that a healthcare provider with a motivated patient can be able to identify early enough for them to make the necessary referrals to a mental health specialist for the patient to continue to be treated. Remember, I say that treatment of diabetes is a team. It's not in isolation. So you might get yourself fatigued dealing with only one patient and you have 80 patients to see. So at the earliest opportunity, refer the patient and make sure that there is follow-up and you have confirmed that the patient was able to go to the place where you referred them to. Yes.
Thank you. As we come to a close, what are some of the complications that are associated with diabetes? We've touched on some of them, the mental issues. Which are other areas that can be a consequence of unmanaged diabetes?
One of the major complications of diabetes, and we can look at them by identifying a few organs that are found in our bodies. One of them is cerebral saturation, the blood supply to the brain. and also the brain itself. Patients with diabetes are found to have, again, a threefold risk of developing cardiovascular accident, commonly known as stroke, as a result of the damage that those high blood sugars cause to the major blood vessels in the brain. The other major organ within the head is, as we said, the eyes. It can cause blindness as a result of damage to the small blood vessels that are found in the retina. And when you come to the heart, they will either have an acute cardiac arrest or they will have heart failure, which is a process that goes on slowly, where the pumping ability of the heart is greatly affected to the extent that it's not able to supply the body tissues with oxygen and nutrients, or even to remove the waste. And while I am at this, if you find a patient as a healthcare provider who is either pre-diabetic or has diabetes, and you are the one that made the first diagnosis, you need to assess this patient for other cardiovascular risks, because it has been shown that patients with diabetes are also more likely to have hypertension, or patients with hypertension are also more likely to have diabetes. You need to assess the patients in terms of their cholesterol levels, because again, patients with diabetes will have high cholesterol levels, and that we are talking of the bad cholesterol and very low amounts of the good cholesterol, which is called high density lipoproteins. Then you also need to assess the patient for obesity. We have mentioned about the body mass index, and for our viewers, if they have forgotten from our earlier presentation on hypertension, we mentioned that when you go, your weight is taken, and then also your height is taken in terms of meters, and then your height is squared, and it is used as the denominator to divide the weight, and then you are given a figure. So any figure below 25 to 18 is generally regarded to be normal, but better there around the middle, 22 to 23. Any figure above 25 to 30 is overweight. And in fact, the recommendation for people with diabetes is that their body mass index must, under all circumstances, be kept there above 25. If it is above 30, that is obesity. So you need to identify patients that are obese. In fact, the recommendation is that should you find a patient who is pre-diabetic, as we defined it, and is having morbid obesity, probably greater than 35, that patient is started on a drug as you institute the lifestyle changes and dietary changes that you need to mention. So that is the heart. Then the kidneys, very, very important. Diabetes is actually the commonest cause of kidney disease, chronic kidney disease. Majority of them are caused by diabetes. And therefore it is important for us to control the sugars to save the kidneys. And then of course the extremities I have just mentioned, in terms of both the major blood vessels therein that are affected to the extent that blood cannot flow to the feet. And also the loss of sensation. And you find that a patient presenting with those defects, you either most likely do an amputation. And also there is deformities. I don't know whether you've seen people with deformed feet. They have been deformed by diabetes again. And there's something else that I needed to mention. When you find that a patient has diabetes and one more cardiovascular risk, then this patient is directly started on drugs. Yes, you start them on drugs as you continue with the other things, as you need also to be proactive in as far as treating those other comorbidities is concerned. You need to treat the high cholesterol levels, you need to treat hypertension, because if you don't treat them and you concentrate on treating only the diabetes, you have not reduced the risk for an adverse cardiovascular event happening to these particular patient.
Okay.
Yes.
We are almost coming to an end to this, and you've mentioned about obesity, and I believe we'll take this up as a topic for coming sessions, because it seems like it has a lot of risks associated to it, and it's more lifestyle than it's something that can be controlled.
It is both lifestyle and dietary, and I think it is important for me to mention dietary changes that you need to institute just briefly. One of the things that healthcare providers will tell a patient with diabetes or with pre-diabetes is that you need to reduce your consumption for sugar. You need to keep your carbohydrate consumption to the lowest level. If you manage to put your carbohydrate consumption to the lowest level recommended, you will control your diabetes. Even without drugs, carbohydrates reduction is very key. In terms of the carbohydrates, it's recommended you take the ones that have not been refined, where you find that there is a lot of fiber. Don't add sugar to your, don't be this kind of a person who wants to add, to make the sugar as sweet as it can be, because it will ruin your chances of controlling your blood sugar. Then the recommendation is that you need to eat your cabbages and fruits. It should be the biggest portion, occupying half of your plate. I'm very sure if you look at how people eat their ugali, you just find the skumas in a corner somewhere.
Exactly.
And the whole plate full of ugali.
Unapewa ugali yote, a lot of meat with no vegetables.
With no vegetables at all, and there will be no fruits thereafter.
Yeah.
It is recommended for diabetic patients that your half of your plate should indeed be vegetables, and the vegetables must be the ones that contain the least starch. No, people do not know that peas are vegetables. Beans are also vegetables, but they contain a lot of starch. Even potatoes are vegetables, and they contain a lot of starch. In fact, even corn, the one that we eat when it is still mahidi yenye ya kuchemusha, you can call them vegetables, but they have a lot of starch. So the vegetables that have less starch include cabbages, the tomatoes, the sukuma wiki. Those ones you increase their quantities. The spinach, you increase their quantities. And for the patients with diabetes also, the recommendation is that the amount of protein they need to consume some protein is recommended. I'm very sure for most of them they have been given by their nutritionist. And then water is very important. Replace your sweetened beverages with water. Take like 15 glasses of water in a day, and you will be. Don't take a lot of. Don't take a lot of sodas and juices, ribena. Those ones and the tea. Keep them to the minimum and do whatever is needed. In terms of exercise, not less than 3 to 4 times in a week. Yes, divide 150 minutes in a week. You divide it how you want to divide it. Brisk walking is good enough, but even vigorous exercise for those that can afford and the ones that are young is also recommended.
Okay.
Yes.
Thank you so much, Dr.
Okay.
We cannot actually. I think we've just scratched the surface on the issue of diabetes, and I believe that we will take it up and look more intricately and in detail about diabetes so that our viewer can have the benefit of the information. Thank you so much for spending time with us. And I believe that our viewers have found this to be a meaningful time they've spent with us. This is Just Connect Online TV. Me and my show, Karibu Sana.
Just Connect TV, streaming live. Just Connect TV is your entertainment and educational channel. We broadcast authentic content that will inspire, empower, and stir up the potential and positive energy in you. Just Connect TV, streaming live. Ever felt the need to learn how to play a musical instrument or improve your music skill and never knew where to go? Just Connect School of Music is the place to be. We offer professional training in music sight reading, piano, drums, guitar, saxophone, bass guitar, and vocal training. We are located at Eprin Square, 3rd floor, room 26, opposite Buruburu Police Station. Just Connect, building worship. Get yourself a high-quality branded hoodie, t-shirt, cap, umbrella, you name it, we got it. You order, we deliver. Just Connect. Just Connect TV, streaming live.